Hey guys, welcome back. Today we will discuss about nursing diagnosis and care plan for hernia. So what is hernia? Hernia means it is an abnormal protrusion in any part of the body, especially we can see in the inguinal region and also in umbilical region. So what is hernia? Hernia usually happens in your abdomen or groin when one of your organs pushes through the muscle or tissue that contain it. It may look like an odd bulge that comes and goes during different activities or in different positions. It may or may not cause symptoms such as discomfort, pain. Most hernias eventually will need surgical repair. So in this image, clearly you can see how the protrusion will look here. Here you can see an umbilical hernia, inguinal hernia, and femoral hernia. These are all the common hernias. So the major locations of hernias are in your lower chest through your diaphragm, in your groin through your lower abdominal wall, along the front midline of your abdomen through a former abdominal surgery incision. There are different types of hernias, and inguinal hernia are the most common type of hernia, accounting for 75% of all hernia. They mostly affect men. They happen when part of your bowel protrudes into your inguinal canal passageway that runs down your inner thigh. Femoral hernia, that is another type of hernia, and it occurs in the femoral canal, which runs underneath the inguinal canal. Next is hiatal hernia. It occurs during your lifetime and it happens when opening the diaphragm where your esophagus passes through widens and top of your stomach pushes up through the opening into your chest. Next one is congenital diaphragmatic hernia. It is a diaphragmatic hernia. It is a serious birth defect in which the diaphragm doesn't close all the way during fetal development, and it can cause abdominal organ to slip up into the chest cavity while the organs are still growing, crowding the lungs. Then incisional hernia. From the word you will get the meaning from the incision. An incisional hernia occurs when tissue protrudes through a former incision in your abdominal wall that weaken over time. It's a common side effect of abdominal surgery. Next is umbilical hernia. An umbilical hernia occurs when part of your intestine pokes through an opening in your abdominal wall near your belly button or umbilicus. Most umbilical hernias are congenital, that means present from birth. Ventral hernia. A ventral hernia is any hernia that occurs through the front wall of your abdomen. It includes umbilical hernias and incisional hernias. Last one is perineal hernia. A perineal hernia occurs when organs or tissue push through an opening or weakness in your pelvic floor into your abdominal cavity. These hernias are relatively rare. Now we will see the nursing diagnosis and care plan. The nursing diagnoses are acute pain related to pressure from protruding tissue or organ as evidenced by patient's verbalization of pain, restlessness, facial grimacing and guarding. Second one, risk for impaired skin integrity related to surgical incision and potential tissue trauma. Third one, knowledge deficit related to lack of information about hernia condition, surgical procedure, and post-operative care as evidenced by patient's questions and expressed information needs. Next one, impaired physical mobility related to post-operative pain or weakness as evidenced by limited range of motion, reluctance to ambulate, and slow movements. Last one, anxiety related to the diagnosis, potential surgery, and fear of complications, as evidenced by verbalization of fear, restlessness, and tense facial expression. So these are all the nursing diagnoses I have selected. Now we will see the care plan. First one, acute pain. Subjective data, patient verbalizes sharp abdominal pain. Objective data, restlessness, facial grimacing, guarding, behavior elevated, and vital signs. The diagnosis column include diagnosis and goal. Acute pain related to pressure from protruding tissue or organ as evidenced by patient's verbalization, and restlessness. Goal. Short-term goal. The patient will report pain relief within 30 minutes of intervention. Long-term goal. The patient will demonstrate effective pain management techniques and comfort. When it comes to the planning column, evaluation, rational and implementation columns, assess pain using a standardized pain scale to evaluate treatment and effectiveness, assessed pain and documented. Administer analgesics as indicated, rational to relieve pain and promotes comfort. Implementation, administered analgesics. Next planning, encourage patient to use relaxation techniques such as deep breathing exercise, rational to reduce perception. Implementation, encourage the patient to use relaxation technique. Next planning, position the patient, especially semi-fowler position, to reduce the discomfort. Implementation, position. And in evaluation, you can write patient reports pain level reduced to 3 by 10, appears relaxed, less restlessness. It should be based on your goal. Then, next, nursing diagnosis. Risk for impaired skin integrity related to surgical incision and tissue trauma. Subjective data, patient states that concern about incision healing, or patient states concern about incision healing. Objective data, presence of surgical incision, risk of tissue trauma from procedure. Diagnosis column, risk for impaired skin integrity related to surgical incision and tissue trauma. Goal, patient incision will remain clean, dry and free from infection, and patient will verbalize the understanding of incision care. Planning, inspect incision site every shift for redness, swelling or drainage. Forward to detect the signs of infection. In implementation, inspected the incision. Next, maintain aseptic technique during dressing changes. Forward to prevent contamination and promote healing. Maintain aseptic technique. Encourage adequate protein and fluid intake to promote wound healing and tissue repair. Encourage for adequate nutrition. Educate proper wound care at home to promote self-care and reduce the risk of complication. Educated decline on wound care. In evaluation, you can write incision shows no signs of infection. Patient demonstrates proper wound care technique. Next, planning and nursing diagnosis is deficit knowledge related to hernia condition, surgical procedure, and post-operative requirement. Subjective data, patient asks, what should I avoid after surgery? That means it is something related to knowledge. Objective data, knowledge deficit regarding condition, surgery, and post-op care. Diagnosis column, you write the diagnosis, deficit knowledge related to hernia condition, surgical procedure, and post-operative requirement. Goal, the patient will verbalize understanding of hernia, surgery, and aftercare before discharge. When it comes to planning, rational, and implementation, assess current knowledge and learning needs to understand the baseline of knowledge, assess the knowledge, explain hernia, surgical procedure, possible complication in simple language to reduce anxiety and improve complaints. Explain hernia, surgical procedure, and possible complication in implementation column. Teach patient about activity restrictions like avoid heavy lifting to prevent recurrence and complications. Taught and demonstrated. Provide written instructions for reinforcement to enhance retention of information. Provided written instructions. So, in that way, you have to write the planning, rational, and implementation. And when it comes to evaluation, it is based on your goal. Patient will verbalize the understanding of hernia. So, in evaluation, patient correctly explains the precautions, follow-up, schedules, and incision care. That is next nursing care plan. Next one, impaired physical mobility related to post-op procedures and post-operative pain or weakness. Subjective data, patient states difficulty moving due to abdominal pain. Objective data, limited range of motion, slow movements, reluctance to ambulate. In assessment column, write you have to write the subjective data and objective data. When it comes to diagnosis column, impaired physical mobility related to post-operative pain or weakness. Goal, the patient will gradually increase activity to and ambulate safely with minimal assistance. The patient will gradually increase the activity tolerance and ambulate safely with minimal assistance. And in planning, rational and implementation column, always planning in present tense. Assess the mobility level and encourage progressive ambulation tolerated to prevent complications such as DVT and pneumonia. DVT means deep vein thrombosis. Assess the mobility level. Provide analgesics prior to ambulation to facilitate mobility and pain relief. Provided analgesics based on prescription. Encourage the use of abdominal support like splinting when coughing or moving to reduce discomfort and protect incision. Encourage the use. Collaborate with physiotherapists if needed to provide specialized mobility support collaborated with the physiotherapy. So in that way, you have to write your planning, rational, and implementation. And evaluation, the patient ambulated 20 meters with minimal assistance, reported reduced discomfort. So like that, you have to write the evaluation. Then last one, anxiety, subjective data, patient verbalizes fear. I'm worried about surgery and complications. Objective data, restlessness, tense facial expressions, and increased heart rate. And this diagnosis, anxiety related to diagnosis, surgical procedure, and fear of complication. Goal, the patient will verbalize reduced anxiety and demonstrate effective coping strategies. Okay, in planning column, give honest information about the diagnosis. Then we can reduce the fear of the condition provided honest information. Encourage the patient to express feeling and ask questions for what to promote trust and decrease the anxiety. Encourage the patient to express the feeling. Offer reassurance and emotional support for what to help to reduce the stress response. Offered emotional support. Involve the family in teaching and reassurance. For what? To provide additional support system. Involve the family in decision making process. And in evaluation, you have to write patient verbalizes decreased fear, appears calmer, and asks informed question. Like that, you have to write the nursing care plan for anxiety. All right, guys. So these are all the nursing diagnosis and care plan for hernia. Hope you understand, guys. Thank you.